Okay, hi, this is Dr. Silvester here at the Next Step Foot and Ankle Clinic, and I'm talking to a patient who has kind of one of the first people in Texas to have what's called the MICA procedure. It's a minimally invasive bunionectomy. And this is a lovely patient of mine. She's been a patient of mine for quite a few years, and so she's going to tell us a little bit about her experience. So first of all, Mary, tell me about how long did you have pain with your bunion before you had surgery?
I would say about maybe 3-4 years. It was very painful.
Okay. And you also had one interesting thing about this patient that makes her really special is she had a traditional bunionectomy by me several years ago, a more open procedure. So tell me a little bit about your experience with your left foot where we did the traditional bunion surgery.
It was very, very painful. I had my foot up for a long, long time with a bunch of pillows, and but it was very painful. It was painful for a long, long time. The pain just wouldn't go away, especially at night. It would hurt a lot, and I would have to be taking pain pills most of the time because it was very painful.
Yeah. Yeah, so she didn't have a great experience with that bunionectomy, and that honestly that's kind of unusual with the traditional bunionectomy, but you know, it happens to everybody. It was every doctor, unfortunately, she had more pain than she wanted. Now, she's 2 weeks after having the MICA procedure now on this other side, on her right side, because we wanted to try and find something that gave her a little less pain. So tell us how your experience has been for the last couple of weeks.
It's been wonderful because it doesn't hurt that much, or very, very, very little, but not that much. Okay. You know, so I don't have to take that many painkillers because I don't need them, you know.
Okay, great. And how do you know, your scar before, was your scar?
It was a big scar. These ones are, I think they'll go away because they're very tiny. They're probably not even half an inch. They're very tiny.
Okay. So actually she's 2 weeks after surgery, and we told her today she can go into a tennis shoe if she wants and start walking in a tennis shoe. So that's pretty much faster recovery in general than a traditional bunion surgery. So would you mind if we take some close-up pictures of your foot to show people the scars?
You can go ahead and do that so people can see, you know, that it's very minimum, you know.
Let's turn your foot this way. So this is a traditional, this is the scar. It's 2 weeks old. She's got a little bit of a scratch there. It didn't quite heal up. Here's another one that you almost can't see. And then you can't see, there's two more here, and really you can't see either one of them. So that's the extent of scarring after a bunion surgery with this new procedure. The other thing we really like about it is the toe moves really, really well. See, already she has really great motion in her first metatarsal phalangeal joint. And with traditional bunion surgery, that just doesn't happen very much. You have to really work at that and do a lot of physical therapy to get that back. So it's a great new technique for bunion surgery, and we're excited to offer it to people here in San Antonio. Would you do this procedure again, or which would you rather have, the little one or the big one?
This little one, because this one is not painful at all.
Okay. All right, great. Well, thanks so much. That's so you don't have to believe me, you can believe a patient. Thanks for listening to us. And if bunion surgery is something you might want to consider, please give us a call here at the Next Step Foot and Ankle Clinic.
And Dr. Silvester is great. He is a good doctor. I've been following him forever, so he's good.
And we paid her to say that. Okay. In a shirt. We gave her a shirt. Anyway, thanks so much. Bye-bye.